Welcome everyone to the Thrive series. We're excited to welcome you back to the fall 2021 series. If you have attended a Thrive program before, welcome back. If you are new to the series, we are so happy to have you here. We had a great session last week, and so I'm excited to kick off session 4. The Thrive program is a collaboration between mHealth Fairview and the Masonic Cancer Center at the University of Minnesota. Today is the 4th session. We have one more regular session next Tuesday, October 12th. We then have one final special breast cancer session on October 26th. I'm hoping that you'll be able to join us both for those two. Tonight, we will hear from Chris Newcomer and Emily Myatt. These two will discuss resources and ways to get involved in the Minnesota cancer community and find personal growth. All right now, and I will let our speakers take it away. Thank you.
Hi, everyone. It's so nice to see all of you virtually. My name's Emily Myatt. I'm the Minnesota Government Relations Director for the American Cancer Society Cancer Action Network, or ACS-CAN, and I'm really excited to join forces with Chris to talk a little bit about harnessing your story and finding your passion.
So, and I'm Chris Newcomer. I am the Vice Chair, soon to be Chair of the Minnesota Cancer Alliance, and I am also the project manager for a project called the Breast Cancer Gaps Project, focusing on the astounding and atrocious mortality rate of African American women from breast cancer in our community. So I'm going to talk a little bit about the first part, about finding your passion. The title of this conversation was After the Bell Rings, Finding Your Passion. For those of you who have finished active treatment, you're going to know what after the bell rings means. It's the bell that you get to ring when you're done with your final chemo treatment. And a lot of times that bell ring signifies a change in what's happening in your cancer life and your cancer journey. So I'm going to talk first a little bit about survivorship. I know this whole conversation that you've been having for 3 times, I'm the 4th and you have one more, is about survivorship. And I always think in my 7 years of running Firefly Sisterhood, we always had this dilemma about the medical definition of survivorship and sort of the communal definition of survivorship. The medical definition of survivorship is you are considered a survivor from the day of your diagnosis, which sometimes can feel odd. I think the community definition of survivorship is when you are done with active treatment. So you've actually finished any treatment and now they say, okay, you're off, go ahead. This is really old data. There are 230,000 cancer survivors in Minnesota. I think the latest national data is that there are over 16 million cancer survivors in Minnesota. One caveat about using the word survivor is the metastatic caveat. So if you are a metastatic cancer patient, you're technically not considered, you don't feel like you're a survivor because you're always in active treatment. So that's the reason why sometimes survivorship gets to be a funny word. The other thing about survivors is that you're living longer and you're living healthier. And I think the last couple of segments you had on survivorship is a testament to that, living longer and living healthier lives, because we've known so much about what's happening in cancer. So after the bell rings, you kind of say to yourself, so now what? What do I do? What's me? Who am I? What's my passion? What am I going to do? I think one of the questions that survivors ask themselves is cancer my identity or is it not my identity? Some people say it will never be my identity. And some people say, I'm so changed, it will be my identity. So you have to kind of think about what is that going with you? I'll give you an example. So my sister-in-law, which is one of the reasons I was instrumental in starting Firefly Sisterhood, recently died of metastatic breast cancer 2 years ago. Cancer was not her identity. And in fact, at the end of her life, they were talking about where they wanted donations sent. And it wasn't cancer organizations, because that was never her identity. Yet I've known wonderful people in Firefly Sisterhood, both people using our program and our mentors, who said, this is my new identity and I'm going to work with it, not against it. The other thing about Now What is you're kind of always on guard. There is that little, I call it a little stone in your heart that always says, whoops, is this going to happen? What's going to happen? Is this going to come back? So whether you're done with active treatment and you're cured or whatever your physician or clinic has told you, you're still always on guard. And that I don't think ever goes away. The reality is you're not the same. You physically may not look the same. Your insides may not look the same. Your hairs may be a different color, but you're just not the same after the end of cancer treatment. So you're sort of working on what is my new me and what am I going to be doing and how do I take this experience? The other part of the Now What of survivorship is, so I have a list of my medicines. The end of your treatment, you get a list of your medicines, your treatments, what you had, all this stuff. And it's a nice packet you get. But nobody says, so what are you going to do now? How are you going to find your passion? I have this list of medicine, but what's next in my life? The other thing about survivorship, I think, which draws people to search for ways to be involved in the cancer community is, we start out calling it friends and family fatigue at Firefly. And it really is my family and friends think I'm done. They don't want to talk about it anymore. They're like, really? Could we just talk about the Vikings? That would be so much better. But I don't feel done. I really don't feel done. So sometimes a way to feel done and to move through it is to either go to one of the support programs I'm going to talk about later, or become a volunteer in one of them, because that allows you to find people to kind of help you process it who understand. The genesis of Firefly Sisterhood when we started it was that peer mentoring has an actual effect on treatment and how you respond to treatment. So if you've got somebody to talk to who's been there and can answer questions about things that your physician may not know, and there are all sorts of things physicians don't know about breast cancer, trust me, that we talk about, but it gives you a place to kind of work through those. We have 130 women who are, and I'm the former executive director, but I just stopped in like May, so I know all this stuff. 130 women who are peer mentors. They want to give back because for them, we learned that it's as important for them as it is for the people they mentor. So that's kind of the now what of like, what do I do? The spell is wrong. How do I find my passion? One of the areas that a lot of work is being done in our community, and trust me, we have an amazing cancer community around here. People who really come together and work on all aspects of cancer together. There's Emily, you're shaking, it's amazing. They may all fight for dollars, but when it's time to work on how they can best help patients, they all come together. So, and I think you're going to go into a lot more of this in the next session when you have social workers and other people helping you thinking about what is going to be your emotional and psychological and spiritual journey. But I just did want to give you the definition of psychosocial support, which you'll hear. You have your medical support and you have your psychosocial support. So a psychosocial support is addressing the social, interconnecting with people, psychological, emotional, spiritual, and functional aspects of their survivorship journey. When they talk about social and psychological, I'm sure some of you have read a lot of the work done on what happens when people are isolated from other people, and COVID has definitely made that more apparent to all of us. But there is a health outcome that changes when you are in isolation. So psychosocial support when you have cancer is really important because that isolation could potentially affect how you respond to treatment and your mortality, as a few studies have shown. Functional aspects of psychosocial support include things like finding support if you're having insurance issues with your insurance company, or you're having issues with getting your disability, or your kids are really struggling and need to be around other kids who are having the same issues whose parents have cancer. So these are all the things that make up psychosocial support. In your clinic, you'll find this through your social workers, your nurse navigators, and your staff. I'll share a list of community providers later in the presentation so you can see the breadth of the community survivors. And there are lots of online support groups and resources that are very popular and very useful out in the community. I know people say, oh, don't go to the web, but there are some reputable online resources that you can find in support groups. So what is finding your passion? What does it look like? At the end of active treatment, there's kind of two approaches to how you address what is in those really, but I don't believe are great words, your new normal. There's nothing normal about it. You're not going back to anything normal. It's your new, who you are now kind of approach. But people take two approaches, and they're not mutually exclusive approaches. One is, I don't want to have anything to do with my cancer. I'm done. I don't want to talk about it. It's over. The other one is, how can I use my cancer experience to help others? And people go back and forth between these two. It's not one or the other. In Firefly, a lot of women came because they wanted to use their cancer experience to help others. And after 3 or 4 years being a peer mentor volunteer, they said, you know, I'm really kind of done. I don't want to really have anything more to do with cancer. I'm just done. So, and other people come back and say, it's 5 years out. Now I feel ready. I want to be involved. What can I do to help? So it's really something to think about. You don't have to go and take this experience right away and be involved, but the door's always open. I also want to make a caveat. So this came from my daughter, who's 35 years old. She'll walk into my house and want to have a conversation, and she'll look at me and she'll go, Mom, this is a judgment-free zone. Okay, we're not judging tonight. And I think I'm going to give you the blessing to use that with people when they say, why aren't you doing something, or you're doing too much? Just remind them that just got through cancer and I'm living in a judgment-free zone. I think that will help you out with that. So let me talk a little bit about the Minnesota Cancer Alliance. The mission of the Minnesota Cancer Alliance is to reduce the burden of cancer for all Minnesotans, which is a pretty lofty mission, but I think the Alliance has been making some headway on some metrics that we have on reducing that burden, except then COVID struck. So maybe we're not doing as well as we thought we were a couple of years ago. It is an independent alliance of cancer clinics, nonprofits, the Department of Health, and community members. I know Masonic is a member of the Minnesota Cancer Alliance and actually has a Masonic staff member sitting on our steering committee. We created in 2015, the Alliance created a 10-year cancer plan, and that cancer plan focuses on prevention, detection, treatment, survivorship, and health equity. And I'm going to tell you a little bit about those areas. We focus on, those are our 5 strategic areas, and within that we have 19 objectives that we work on. 19 is a lot, but there are a lot of things that are really going well with what we're doing. So prevention is things like obesity, tobacco, radon, HPV, all those things that we can do upstream to prevent cancer from occurring. Detection includes screening for all cancers, really focused a lot on cervical, lung, colon, and breast cancer, but other cancers, and also genetic counseling. So that is becoming more and more of something that people want to have in their cancer work, is genetic counseling, because it does make a difference. Treatment is clinical trials, and I will tell you that Masonic has taken a lead in clinical trials, the Clinical Trials Network, which is a network of the Cancer Alliance of people all the clinical trials in one place, that they're going out and reminding people and enrolling people and messaging people that clinical trials are happening in our state and they're open for you. So clinical trials, advanced care planning, palliative and hospice care. And we actually keep palliative and hospice care separate at the Alliance because hospice is not palliative and palliative is not hospice. And that is a kind of a misnomer that people don't understand. So we want to make sure that part of our work is helping people understand the difference between the two. So that's what the Minnesota Cancer Alliance does. We're really led by a volunteer steering committee and leadership team. We get support from the Department of Health. They have a program called the Cancer Control Program, which is actually funded by CDC. So every state in the nation who gets the CDC money has to have a cancer alliance or organization that works with the cancer plan. So we make and we fund, how we do a lot of our work is we fund strategy action grants to jumpstart our work on the 19 cancer plan objectives and goals. So for example, we've had a strategy action grant on radon, colon cancer, right around 2012, they did a lot of work on getting kids out of tanning beds and some legislative work, which I know Emily can talk about. We have a huge clinical trials network. They funded a breast cancer gaps project, which is looking at how we can pilot some programs for reducing that breast cancer mortality in African-American women. So that's the Minnesota Cancer Alliance. We love having you guys come, being a part of it, being on our committees. We have these work groups, and we really are focusing on reducing the burden of cancer. So sorry, this is a little fuzzy. I didn't have a good copy of it because they've all been distributed. This came out of a Cancer Alliance strategic action grant. And these are all, not all, but these are a group of organizations that have come together and they call themselves the Community Cancer Leadership Collaborative. And what they do is they get together twice a year. They're all program managers of nonprofit cancer support programs to talk about how they can better work together and help more patients. So I'm just going to kind of give you a quick little around the world understanding of what each of them do. So, and these are all ones that are looking for volunteers, but they are also there to support you as survivors and in active treatment. So they are the ones you call if you need to talk to somebody about a bunch of different things. So Rainin Sarcoma works on sarcoma cancer research, and it also supports patients and families. Pathways is really a holistic center for programs that serves cancer and chronic illness. They've got a beautiful little space on Lake and Hennepin, where they hold classes that are incredibly reasonably priced. You can take things like yoga, art therapy, Reiki, all sorts of different integrative health classes at Pathways. Open Arms of Minnesota really got started with the AIDS epidemic, and they do medically tailored meals that you can get to cancer patients. And they deliver their meals. I think they deliver once a week, a set of meals within the $4.94 and $6.94 range. So if you are a cancer patient, you can call, and if you qualify, they can help you. They can bring food to you. The Minnesota Ovarian Cancer Alliance raises money for research and awareness of ovarian cancer and does some support for ovarian cancer. One of my favorites is Jack's Caregiver Coalition, since they started the same year that Firefly started. It was started by a man whose wife had, I think it was stage 3 colon cancer, and there were no resources out there. And he really felt a loss about that. So he actually left his job and started Jack's Caregiver Coalition. So they do both support groups, but they also do, because men sometimes don't like to go to support groups, let's really be honest here sometimes. And so what he came up with, which I think is really great, is they would have these events where men would get to be able to come and meet each other and then maybe learn to talk to someone about who they were caregiving in cancer. So one of their events was, learning how to drive backhoes up in Elk River. There's a big place you can go, bring a group and all drive backhoes. So those kinds of events that he does, ice fishing, things like that. So again, that's a great resource for male caregivers, although female caregivers can go to their support sessions. Gilda's Club, which again, has been around 8 years now. It really is where you can find support groups, classes, education programs, cooking classes. It's, as they call it, they're really comprehensive and they serve all cancers. They have been virtual for the last 1.5 years. I think they are reopening their clubhouse for some in-person classes recently. It's all free. All of these programs are free to anyone. A little bit about Firefly Sisterhood, my baby. It was we started 7 years ago to foster one-to-one connections between women who are experiencing breast cancer and those inspirational survivors. It's the kind of been there, done that model. So currently they've served probably over 2,000 women in the state of Minnesota in the last 7 years. Brighter Days Grief Center and Youth Grief Services have actually merged. They support kids whose parents are in cancer, have cancer, or have died. Brighter Days supports individuals when they're anticipating a death or coping with the death of a family member. And they also have a lot of peer-based connections. Cancer Legal Care is a great organization. They started as just helping people get their disability or any kind of workplace issues for legal work. And recently they've branched out into helping people who are getting these very large insurance bills that they don't think are fair or they look wrong, and going in, and they have an insurance specialist on their staff now that can help people renegotiate large insurance charges. And I can't remember the name of the program, but it's been really successful. They also will help with employment issues and wills if you need one, all of those things. Breath of Hope Lung Foundation is really the lung cancer support organization. It connects families with rides and companionship. They also raise money for research. And the last one I'll talk about is Angel Foundation. They provide emergency financial assistance and social and emotional support to adults, but also they run a kids camp that's available for kids who have cancer, and so, or who don't have cancer, but their parents have cancer. So they will come together and do a camp for them. I think it was virtual last year, but hopefully this year it will come back. And they also, Angel Foundation just started, I think with some help from Cancer Legal Care, is a financial planning program where if you need to do some financial planning as you're going through your cancer journey, they have a connection with Ameriprise, and they have reduced rate financial planners who will come in and help you. So those are all the resources in this amazing community we have of cancer people, and the cancer community is very giving and very committed to the work that we need to be doing around reducing the burden of cancer and making your journeys and your experiences as easy as possible. So just for information, my contact information is here, and you can go to minnesotacanceralliance.org if you want to learn more about the Cancer Alliance. And I know any of these organizations, when you go to find your passion, would welcome you. So with that, I will turn it over to Emily.
Thank you, Chris. Do you want to go to the next slide? Perfect. So hi, everyone. Again, my name's Emily Myatt. I'm the Government Relations Director for the American Cancer Society Cancer Action Network. We call it ACS-CAN for short because it takes a very long time to say that. Today, we're going to talk a little bit more about your story, your experience, finding the power in your story and ways to tap into what you've been through or a loved one's been through, to find your voice to advocate for change. And advocacy can be a couple of different things. I'll add that as the Government Relations Director, I'm our primary lobbyist for ACS-CAN at the local, state, and federal level, especially here in Minnesota. And I'll talk a little bit more about what ACS-CAN does, but first I want to talk a little bit about who I am. Next slide, please. So I'm excited to join this group also because I'm a cancer survivor. I was diagnosed in 2009, which was my sophomore year of college, with a neuroendocrine carcinoma. The year prior, 2008, my mom was diagnosed with breast cancer. And that was my freshman year of college, right the first semester. And we thought, okay, after surgery, chemo, radiation, like, all right, we're done with cancer. We had our cancer experience. That's great. Goodbye. We'll fast forward over a year, and I went to the ER with symptoms of a UTI and kidney stones. And I'd had a history of kidney stones, so they gave me a CT scan. And in that CT scan, they found a calcium stone at the tip of my appendix. And they said, well, this isn't your symptoms now, but eventually this is going to cause appendicitis. Let's take it out. So in that pathology report, they found 2 tumors. And that was not the call we were expecting, right? I was home. That was my first surgery. Mom had just had cancer. We were done with cancer. So I dropped out of school for the rest of semester. I was at the University of Wisconsin-Madison. That's why I got Bucky Badger there. Had half my colon removed and began that healing process, which we know is just as much emotional and mental as it is physical. So when I returned to school for the 2010 spring semester, I started interning in legislative offices. I got really interested in healthcare reform and public policy, and that's shaped who I am today. I've been working for ACS-CAN for nearly 7 years, and I have loved almost every minute of it, right? There's all jobs where we're like, oh, but I will say anytime I'm with folks like you, I'm talking with lawmakers about the issues that impact survivors, I am living my dream. And that gets to kind of what Chris was talking about, that some of us want to keep talking about cancer and some of us don't. And there are days I don't want to think about cancer anymore. I'll say my mom did not want to talk about it. She was done. She was, there's a lot of trauma that comes with cancer. But slowly she's kind of ebbed and flowed between those 2 boxes as well. All right, next slide, please. So ACS-CAN is the nonprofit, nonpartisan advocacy affiliate of the American Cancer Society. That's a really fancy way of saying we have the same CEO, we're out of the same offices, but we do our work, the work to eliminate the pain and suffering from cancer, to reduce that burden through public policy. And we fight back through public policy and grassroots advocacy. And I will say that cancer patients and survivors and caregivers really drive the work we do, and that's the power of my organization. And anytime we have any wins, it's because of folks just like you. Some of our recent policy wins include raising the commercial tobacco sales age to 21, securing $6 billion in new federal funding for cancer research over the past few years, making sure folks on Medicaid can access clinical trials and that clinical trials will be covered, and removing barriers to treatment coverage for women diagnosed with breast or cervical cancer. Chris earlier talked about the Minnesota Cancer Alliance. ACS-CAN and ACS are both proud members of that group. I sit on the steering committee with Chris, and I also serve on the policy committee. All right, next slide. Thank you. So cancer survivors play an incredibly important role in the work of ACS and ACS-CAN. The voices and experience of survivors are powerful, and they can drive decision makers and lawmakers to pass policies to improve patient quality of life, to improve access to care, to remove barriers. So ACS-CAN works with survivors to learn from them. We want to inform our work by the experience of survivors, patients, and caregivers, along with science and evidence, because those things are really important too, right? We love data and research to inform our public policy work. And I think the most important thing is, like, any decisions about cancer patients and survivors need to be made with cancer patients and survivors in the room. I'm a lobbyist at the Capitol. I love my job. Obviously, this work is so personal to me, but the voices of those most impacted need to be heard by decision makers, right? There's that saying, no decisions about us without us. And that rings true when it comes to patients and survivors and caregivers. A story is so powerful. We had a cancer survivor testify against a bill that would require folks on Medicaid to work to be eligible for their healthcare coverage. And we know sometimes cancer patients, they can't work. That's not a doable option. And the volunteer got up in the committee room, which can be a daunting process, right? And it was late at night. We had been there for hours. People were starting to get distracted. They're on their phones and their laptops. And this volunteer got up there and shared her story and talked about how, well, does an employer really want me throwing up in a trash can at work because I'm sick from my chemo? And I'll say, it was silent in that room. Everybody, they paid attention, they listened, they were off their phones and their laptops. There were folks crying. I mean, that is the power of a story, to captivate a room who's kind of tired of being there and to share that perspective. It is powerful. And you know what? Our stories are emotional. Our experiences are personal. And that emotion and the person experience, that's what makes connections and makes these policies or issues come to life and show that they're real and those emotions need to be felt. Next slide, please. So I'm going to talk a little bit about one way that survivors influence ACS CAN's work and what we're all about. So ACS CAN launched a project in 2019 called Survivor Views. Survivor Views is a groundbreaking program designed to further engage survivors across the country in important policy issues. And so it's a group of thousands of patients and survivors who take online surveys every month or two to give insight to what they're experiencing with cancer in the healthcare system. What are the issues they're facing? What are the overarching themes from their care, their experience? And we use this information to inform our public policy decisions and to provide that evidence to support policies we're working on or to oppose policies we're really concerned about. When the pandemic started, ACS CAN quickly saw a need to figure out how cancer patients and survivors were being impacted. Before we did these surveys, patients and survivors weren't a huge part of the conversation around COVID. Decision makers were talking about emergency funding and relief and access to who can go to the doctor and surgeries and what's essential medical care. And it was all in the lens of COVID and not in terms of like us, our community. Next slide, please. So through this project, during the height of the pandemic, we learned that nearly 1 in 3 cancer patients in active treatment had experienced delays or cancellations in their cancer-related care because of COVID-19. And some of you might be one of these 1 in 3, right? We were able to use this data to get a lot of media attention on the issue, and it helped inform our work at the Minnesota State Capitol and in Washington, D.C. to make sure that any COVID relief packages thought about cancer patients. When we talk about telehealth and increasing access to telehealth, what does that mean for survivors who need their follow-up care? And so it was a really important piece for us. The newest survey this spring shows that 1 in 6 patients and survivors are still reporting or experiencing delays or disruptions to cancer screenings, primarily because of staffing shortages or concerns about contracting COVID or provider recommending that they put off temporarily. I want to share a couple of other key findings from survivor views that I find particularly interesting. So a majority of survivors say that their providers give them the information they need about regular preventive care. Sometimes we know we've made it through our cancer experience, but then what about the rest of the time, right? What are things we need to look out for? What are symptoms that might be long-term that we didn't really talk about? A top priority and concern of survivors is the cost of healthcare. Right? I don't need to tell you all this. Cancer is hard enough. Financial toxicity and the stress of affordability is not something else we need to deal with, right? So ACS CAN has listened to this and continues to work in Minnesota and across the country on legislation to protect key patient protections, right? We're living with pre-existing conditions, to rein in junk insurance plans, to make sure that more folks have access to Medicaid across the country, and to address high out-of-pocket costs like prescription drugs. And finally, in these reports, we've seen over and over again continued racial, ethnic, and socioeconomic disparities in the healthcare system. Respondents of color or respondents with lower incomes indicate that they believe their doctors see their treatment based off of what they can afford, not what the patient needs, but what the doctor thinks they can afford, and not what's best for them. And I think 15% of Hispanic, American Indian, or Asian patients say they didn't feel like they were active participants in their treatment decisions. And that should be alarming to all of us. So Survivor Views continues to confirm that cancer care and access to care is not equitable. And we know of the major cancer disparities. And so this really drills down that this is something we all must prioritize and continue to work on. So next, I'm going to talk a little bit about advocacy. So as a survivor, you've advocated for yourself with your doctor, with your care team, but you also advocate every day, whether it's trying to get your kids to do their homework, getting your partner to agree to go somewhere for dinner, what movie you want to watch, if you want to turn off the TV and read your book, right? You're always advocating for something. Advocacy shows up in all different places and spaces in our life. And I like to remind folks to think of advocacy as that. It's not lobbying, right? You don't need to know the political process, but it's about speaking up for what you believe in. It's coming together as this community of like-minded individuals for a cause or an issue that we care about. There are powers in number. I love that graphic, and we use it when we train our volunteers. So instead of that big fish chasing us, we're coming together to chase that fish, right? We're taking power and ownership, and we're coming together to really raise our voices. Next slide. So lots of times there are these roadblocks that might come up when you think about what advocacy is. Lack of comfort with the legislative process. You don't know where to start. You don't know where to get help. You don't feel like you're an expert enough to be an advocate. Let me tell you, all of these things are not true. You can feel that way, and I validate those feelings, but you have staff and organizations standing by ready to help you overcome those roadblocks and show you just how powerful your experience is, because you are an expert. You're an expert in your story and your lived experience. And that's what's most important. Facts are wonderful, data is wonderful, and that's what lobbyists can do. But that personal story can really move mountains. And so a couple of, this slide here shows some pictures of advocacy. And again, that can be an intimidating word. People can think about protests or marches or lobbyists. And I'll say not all lobbyists are bad, right? I'm not too bad. Or they think of specialized roles like a patient advocate that shepherds someone through the medical process. But advocacy is something we all do in big and small ways. Anytime you're trying to get someone to move closer to your side of an argument, to see your point of view, that's advocacy. And it looks like all different kinds of things, right? So there's, some of these are from non-COVID days. So just know we're practicing social distancing and masking. But you can see pictures of folks at a rally in the Minnesota State Capitol, all with that ECS Can banner. We have been doing virtual meetings during the pandemic. We get folks to testify in front of city councils or lawmakers at the state capitol. You can sign a petition. You can do door knocking. You can meet with your members in person. Advocacy can be done from your computer, through social media and email messages, through phone calls and texting. Anytime you show up and share your story in support or in opposition of something, you are being an advocate. And I will say, as a lobbyist, all of those opportunities are so important when it comes to making sure that the perspective of patients and survivors are heard, that our troubles, our hardships, our needs, that they're clearly understood by lawmakers. They're only going to know that if we show up. And at ECS Can, my job as a staff partner is to make it as easy as possible for volunteers like you to get involved. We'll give you the training you need. We'll help connect your story. We can help you craft your story, because again, stories are emotional. I tell my volunteers, anytime you can get a lawmaker to cry or to share their cancer connection, that's a good meeting, because you've made a personal connection. And politics and public policy, it's all about relationships, and it is personal. And so your story is powerful. That's what I want to get out loud and clear. Don't worry about those roadblocks. Don't worry about the legislative process. Know that ECS Can staff, and there's other folks that do advocacy as well that I'd be happy to connect you with. We don't care if you are a lobbyist or a public policy viewer. We don't want you to be, right? We want you to just show up and share your story and experience. We'll make sure you have all of the tools you need to feel successful, to feel prepared, to feel ready to jump in and share your story. So the next slide is how you can get involved. We're recruiting a new cohort for that Survivor Views project. So I'll be happy to share a link to distribute how you can sign up for that. If you've been diagnosed or treated for cancer in the last 7 years, you have to be over 18 or a parent or guardian of a childhood cancer patient who has received treatment within the last 7 years. Those are kind of the parameters we have right now. Or you can volunteer with ECS Can, and that can look like lots of different things, from your computer to showing up in person when the time is right and we all feel good and safe and ready for that. ECS Can staff, my colleague Britta and I, we stand by ready to support you, to help you better understand maybe how you fit into our work, to talk a little bit more about our work. So please feel free to email me if you have questions or want to learn more, or visit our website. You can sign up there just to get more info and hear more about our work. So I am excited to now turn it over to bring another survivor perspective to this conversation. And Chris, you can go to the next slide. So Kelly Leibold is a 5-year cancer survivor. She lives in Pine Island, Minnesota, and she's a volunteer for the American Cancer Society and ACS-CAN. And Kelly will tell you more about her story and her advocacy experience, but she's an incredible human. She serves on the Pine Island City Council. She works with the local Chamber of Commerce. I had the pleasure of meeting Kelly like 4 years ago now, and just it's been a joy to see her shine and to see her share her story in all these different ways. So Kelly, I'll turn it over to you.
Fantastic. Well, thank you for that glowing introduction, Emily, and thank you for having me on this call. It's so inspiring to be able to network and hear from other survivors and those going through treatments, because that solidarity helps us, it validates our emotions and it motivates us going forward. As Emily mentioned, I live in Pine Island, just north of Rochester, and I'm coming up on my 5-year anniversary of being diagnosed with brain cancer. I was just 20 years old, so I just started my first full-time job when I moved into my first apartment with my first roommate. And to be diagnosed so abruptly and have that all stripped away from me was shocking and very frustrating at the time. A CT scan found the tumor in my cerebellum on a Tuesday, and less than 48 hours later, I was in emergency brain surgery to remove that cancerous tumor. After surgery, I underwent a month of proton beam radiation treatments and 4 months of chemotherapy. And I did want to bring up that palliative care was mentioned earlier. If it were not for the palliative care that I received during my treatments, I don't know that I'd be thriving or doing as well as I am today. As we mentioned, the phrase new normal is a bit tricky to adjust to, but I am trying to find the balance between being involved in my community, speaking up for these issues, and prioritizing what is needed for my health and my safety. I found the American Cancer Society right after I was going through my treatments. My first introduction was being asked to speak at a Relay for Life event, and since then it snowballed into the involvement that you see on the screen here. One favorite memory I have in that upper right-hand corner, my picture with Governor Tim Walz, a little starstruck there. In fall of 2018, I was asked to speak on a panel about access to healthcare and what pre-existing conditions can or can't do. After that panel, a member of Walz staff reached out to me and said, "Can you elaborate on that a little more?" And Governor Walz, candidate at the time, name dropped me in a debate response that was televised on live TV. Being able to use my story and advocate for cancer legislation feels so fulfilling and so powerful. As Emily mentioned, cancer does not discriminate, and we all have a personal connection to it. I have felt very supported volunteering with ACS-CAN, and the staff does an incredible job preparing you to tell your story. Like Emily said, you don't need to know how the legislative process works. You just need to know what your personal story is. They also do a good job at reiterating what is the ask, how are you going to hook, line, and sinker this argument, preparing you so you don't feel like you're walking in empty-handed. I feel constantly fulfilled by this work, and because of the struggles that I continue to go through, I know that this work is incredibly important. Less than 6 months into my treatments, my employer at the time kicked me off their health insurance, so I had to rely on state Medicaid to finish the treatments that I was undergoing. All of these programs are so important and impact us all in very crucial ways, and it's been an honor to be involved and advocate and meet fellow survivors. So thank you again so much for having me.
Kelly, that's one of my favorite memories too. And when I talked a little bit earlier about like how my mom doesn't want to talk about cancer, she was actually there when we were watching the debate together, and my mom like had a light bulb moment, like, our stories, we don't have to do politics, right? Like, this is not about politics. This is about us and making sure decisions are made with us in the room, and really sharing your story. So thank you, Kelly, for everything you've done. And that wraps up my bit that I have. So thanks everybody for your time.
Thank you guys so much for sharing all of that wonderful information, for sharing your stories and your really robust collective experience in the cancer community. So we are so happy to have you all here for sharing your expertise. We are going to move on to Q&A. So we'll give it just a quick second for folks to work on their questions, but one did come in a few moments ago inquiring if you volunteer for Survivor Views, how much is the time commitment? Can you speak to that a little bit, Emily, maybe?
Yeah, it's a 10-minute survey. And we check in probably every 6 to 8 weeks. So it's a little time commit. We try and make it as easy as possible to make sure that we can tap into survivors and hear their stories without taking too much of their time. And I'll go ahead and drop that link to sign up to join the cohort in the chat box.
That's awesome. Thank you so much for doing that. One question that I didn't see tonight, but that I have seen in the past that came to mind is, how do I get my family involved? If there's a loved one in my life who also wants to be an advocate and get involved, but isn't a survivor, what advice do you have for them, both in advocacy work as well as in the community and the other nonprofit groups in our area?
Well, I think, yeah, so in the other nonprofits, there's always a need for a caregiver support team. And I know being a caregiver is an incredibly difficult job to do, and you need support too. So hence Jack's Caregivers came around. But I think there's lots of ways to involve your family in supporting these organizations. With a lot of them have runs and walks and ways to be involved or setting up. So you can do it as a family event. So for example, Minnesota Oncology does Hope in Motion, which is a family fun event. And that money raised there goes to Angel Foundation. So those are nice ways to get involved. For adults, just call them up and say, how can I help? Because a lot of times volunteers need help with mailings and other office. I know at Gilda's, they have an office person who's a volunteer who greets people. So there are all sorts of things involved with that.
And I'd add too, the caregiver perspective is an important one. So when it comes to policy work and advocacy, the more the merrier. We have a couple of volunteers who bring their partners and their kids to events. We had an event at the state capitol outside last weekend, and there were lots of families there that they brought along to help set up through our work to end commercial tobacco use and to really prevent kids from becoming addicted to tobacco, because the tobacco industry has targeted them. We engage youth and young professionals in that advocacy work. We bring them to the Capitol. We've had a virtual week of action or days at the Capitol that really is youth focused. Hundreds of kids in middle school and high school who come to the Capitol and they talk about their experience. And so I think there's ways to plug in regardless of your age. Even if you can't vote, you should share your story and your experience. And so there's opportunities with advocacy for everyone as well.
That's fantastic. And Kelly, I don't want to forget about you. So I would love to hear if you have any ideas as well to that question. Or if you want to talk, you said something too about balance and really finding the balance in your life. And that just really struck me. So I don't know if you have any other comments you could add to that as folks are thinking about, okay, how could I add this into my life if I'm interested in getting involved?
Right. Well, thank you so much. I still struggle with some health issues to this day. As Emily mentioned, you need to be able to, balance advocacy with other things that are going on in your life. I sit on city council and I work with the local chamber. And so I've had to sit down and really prioritize in my life what I am and am not involved in. And when it's all organized and sorted out right, it is more than doable. I feel very supported in the work that I do. And I know that at the heart of the issue, it's very important work. And so it's something that maybe gets prioritized over other things. I mean, you know your body better than anyone else. So you need to be kind and forgiving with yourself. And if you need a rest day or a rest week, you should feel validated and supported in doing that. So I just want to thank you again for the opportunity to be on this call, and talking to other survivors is so encouraging, because as Chris mentioned at the beginning of the call, sometimes your family and friends just have that cancer fatigue and they don't understand what your experience is like compared to a fellow survivor. You struggle with that survivor's guilt and, again, work-life balance. So just having the support group space to network and share experiences is very moving.
And I want to
Listen-
get back to a point that Chris made too earlier about like volunteering can ebb and flow, right? And to echo Kelly's point, like give yourself grace to maybe volunteer for a while, but then to take a step back. And Chris said, this cancer community is incredible and loving and supporting, and we will always have your back as a staff partner when you need to take a break or pause.
And just to add to that, the other thing is you don't have to think about giving back within organizations. It can be as simple as saying, you know what, to your colleagues at work, I've had this experience. Please, I'm available to talk to your friends if something comes up. There is something about that sort of serendipitous mentoring that happens. What I will tell you, and I jokingly say this, but you're allowed also to tell people to not bring lasagna when you're sick as a caregiver or as a survivor or in active treatment. We at one point took a poll of our Firefly people, and the women said that the winner was some woman had 19 lasagnas in her freezer, which has to be a record. But things like helping somebody else go through how do you organize and how do you keep your friends at bay and things like that. All that experience is valuable to organizations, but it's also just valuable in your community to friends and family.
That is so true. And 19 lasagnas, that sounds like a nap waiting to happen. Thank you for that great advice. And I did have a direct message come through. What advice would you have for somebody who maybe isn't at a point where they want to be involved in a cancer community quite yet? Would, you know, I'm thinking I'm a pet lover, maybe going to the local pet shelter and volunteering your time there, or finding that joy if you're not ready or at a point to be involved in a cancer community. Can you speak to that a little bit?
I will, because I know I've been volunteering my whole life, and I think whatever you do, when you think about another person, it helps you rest your body and your brain. So anything like that you're doing that gets you one out of your, like, go to chemo, go to radiation, come home, be sick, be tired, that kind of thing, just allows you to have out in the world. So I think any way you feel comfortable going out and being in the world and helping somebody will give you back more support than you can imagine.
I think that's right. And I would also add that give yourself the space and time, no comparisons or judgments to yourself, judgment-free zone, no thoughts about what you should or shouldn't think you'd be doing, or another survivor you know does this or that. It's about you and what you need, what your family needs, what you need to get through the day. So if it's finding ways to plug in, to do little positive things, that's that. The cancer community will always be here when you're ready and when you need us. And we're ready to help when that's the right time. But I think just listen to you and your gut, and you know what's right.
Thank you all so much. There is, I see Kelly made a comment, staying informed is so important. Don't compare with others. No two cancer journeys or life experiences are the same. And I love that. Thank you so much for sharing those words, Kelly. I think that really sums it up really nicely. We have just a couple moments left before the end of our hour. So if anybody has any last questions that they want to sneak in. Otherwise, we have covered a lot of topics today. And again, we are so grateful for you all being here and sharing your expertise with us. Can you just share real quickly, and I know that you mentioned this early in your presentations, but just before we sign off, how can we stay in touch? How can we know what's going on and find out where to connect with you next time you're all out and about?
I would say the Minnesota Cancer Alliance, sign up for the newsletter, because our newsletter lists a lot of the organization's things that they're doing. Sometimes it lists research, and it also lists projects that are happening. So I think, to me, that's probably the one space. And you're actually highlighting, Lisa, an issue we have is we don't have a central place for all of this information.
My email is my first and last name at cancer.org, or you can go to our cancer.org/MN. Contact info is there. And I just dropped a link in the chat, or what our handle is. We're on Facebook, Twitter, and Instagram. You can also follow me on Instagram or on Twitter. I talk a lot about soccer and BCS-CAN things and my dogs, but always happy to be a resource and connect with folks.
Wonderful.
I just put my personal email. I'm happy to talk to anybody anytime about our work.
Lovely. That is fantastic. And we will make sure that everyone has, oh, thank you, Chris just dropped her email in there. We will make sure anybody watching this at a later time also has access to all of those resources mentioned in today's presentation. So with that, we are about out of time for tonight. So again, huge thank you for being here. We look forward to seeing you next week, where we will get a little bit more insight into resources and opportunities with our social work crew. And as a final reminder, this recording will be available on our website, z.umn.edu/thrive series. Thanks everyone so much for joining us. Have a wonderful evening.
Thank you.
Take care.